there's a lot of anger about what happened to him, how he was treated, and the injustices that really are happening in our country still. I'm having people write me every day. I receive more messages of people who are sharing their stories. There's people who are commenting on our fundraiser page. There's people who are messaging me personally saying, I'm in the same situation as your husband, or my mom is in the same situation because she's being denied an organ, and it's because she's not vaccinated, and all of this stuff. So it's a very real problem in our country, and it is scary because we are talking about an experimental injection. That's still what it is, because there is not sufficient research, and there won't be for at least 20 years about this particular vaccine and how it affects the body. So there was a lot of prejudice and bias against my husband, I think, because of his advocacy work. Because everybody at the hospital, I'm convinced, already knew who he was before he was admitted there for dialysis treatment. He had done a lot of really high-profile work in the community, at the vaccine clinics. We even had done a protest at the hospital to sort of protest the fact that nurses were losing their jobs over mandates, and it was terrible. So he was at the forefront of all of those things.
Tamara Ugolini here with Rebel News. And remember the narrative at the beginning of the COVID hysteria that justified the unprecedented and far-reaching COVID lockdown measures? All done under the logical fallacy of, if it saves just one life, then it was worth it.
To protect your health and your family's health, but also to lift the load on our doctors and nurses, and make sure that you're taking time for yourself to rest and do what you need to stay positive. For a little while, this will be our new normal, and that's okay, because we're in it together. You make a choice, a personal choice, to not get vaccinated, then I will have no sympathy for you when you come to me and said, oh, but I can't go out to a restaurant with my friends, or I'm not being allowed to go to the gym, or my employer is telling me I have to continue to work from home.
Well, fast track to today, and we're seeing needless and senseless death due to the continued enforcement of indiscriminate COVID-19 related suppression measures, like the heartbreaking story of a young father who has died unnecessarily in Sudbury, Ontario, for upholding his own bodily autonomy. Garnet Harper was a 35-year-old happily married father of 5 when he was diagnosed with stage 5 kidney failure, and then refused a referral to receive this life-saving organ transplant due to indiscriminate COVID policies by the London Health Sciences Centre. His untimely death in May of this year, just a few weeks before his 36th birthday, came from complications of prolonged dialysis, which could have been easily avoided if he had been put on the organ transplant list, which both of his brothers bravely and readily volunteered to do for him. Before we highlight a policy, or rather a fast answered question form that denied Garnet this life-saving measure and the justification for its enforcement, his wife and mother of 5 children that he leaves behind in this senseless tragedy joins me now to share his story and his legacy. Here's Megan Garnet.
Yeah, my husband, Garnet Harper, was just an incredible individual. Truly, he had a really bright light about him. He had a warmth to him that was unmatched, I think, by anybody. And everyone that he came across was really drawn to him. He was a very magnetic personality. He was a family man. He had a really large family from childhood, and then also, we had 5 children, and we were married for 12 years. He had a really profound sense of justice, and he also loved community and bringing people together and building relationships. And so those two things sort of together made him a leader. He really stood up for Canadians and showing people how to exercise their rights. Yeah, he paved the way, like I said, for a lot of people. And it was just, I've been telling people that he's just really unlike anybody I've ever met before.
Well, for exercising those rights and for being this advocate, and in terms of trying to uphold things like what we thought we had in Canada, which is bodily autonomy and a right to freedom of medical choice, he really did pay the ultimate sacrifice with his untimely and what I would say unnecessary death. When you were navigating that situation as a family, what was that like, knowing that your husband's life could be saved, and because of these nonsensical novel injection mandates, they were really standing in the way of his ability to live a full life that he had ahead of him?
Oh, it's maddening. It's, it feels like you're beating your head up against a wall, because really, you can talk logic, you can bring data points, you can bring scientific evidence all day long, but then evidently someone just parrots back to you, well, it's the policy. So it was a very, very frustrating experience, very difficult to navigate, trying to understand and make people see, like, it's a policy, but why is it a policy? And is that policy based on accurate information, right? And is this policy discrimination, which yes it is, and is it, like, how can we combat that discrimination and affect justice here so that the person who is requiring this organ is able to get the medical care that they need in Canada?
And while you were navigating this, you were not necessarily relying on a stranger's donation. Garnet had matches within the family that were willing and able and capable to come forward and donate a kidney to him. Where did that go wrong?
Well, in Ontario, when you are diagnosed with kidney disease, which we found out Garnet had in the very late stages in 2022, you are referred from your family doctor to a kidney specialist, and then the kidney specialist takes your case from there. In our case, where we live in Sudbury, Ontario, our hospital, Health Sciences North, does not perform any transplants. So everybody in Sudbury needs to be referred to a transplant center somewhere else in Ontario where the procedure can be completed. So it's up to your kidney specialist to make that referral, so that you can begin the process of testing, cross and typing, making sure that you're a good match and fulfilling all of the other requirements that are necessary for a transplant candidate. Once all of that is complete, then they place you on the list for organ donation so that you are prioritized according to urgency with the Trillium program, which is Ontario's organ donation program. Where it went wrong is our kidney specialist in Sudbury told us that we were not eligible to be referred, so that's like step one, to the transplant center, because Garnet was an unvaccinated individual.
Now, you've shared this email with me that stipulated that, and the verbatim quote that I'm going to read here is, due to the increased risks of morbidity and mortality in transplant recipients with COVID-19, our multi-organ transplant program has a policy regarding transplanting unvaccinated individuals. Mr. Harper's case was reviewed by the kidney transplant team, and as there are no medical or surgical exemptions to receiving the vaccine, he is not eligible to be assessed at our center. So right there, that's the roadblock. And then you just were not able to proceed any further, is what I gather.
That's correct. That's correct.
And was there any rationale for that? Like, were they able to supply you with the data that showed this supposed increased risk of morbidity and mortality? And what did they mean with COVID versus from or of? We know that there are clear differences there now, just in the verbiage that they use, with someone who tested positive or otherwise. What was the rationale if they were questioned on this?
We never received any documentation. We never even got to see the policy from the London hospital. And it was, by the way, is the London hospital where we were referred, which is London Health Sciences Center. And that's the email that you're reading where we received the information. Because eventually we went to our kidney specialist and said, listen, it's wrong that you're not going to even begin the referral process. This is discrimination, and this cannot happen in our country. And so then based off of that communication, which we wrote to him in writing, then he began the referral process to London, at which point we received that email response that you've just read. So essentially denying the referral to the hospital. But then as the summer progressed, well, during the time of those emails is when, he was still feeling fine. He was still working full time. He was really, other than having a difficulty getting up in the morning, and feeling tired throughout the day, he was otherwise feeling really, really good, actually. But then as the summer started to progress, his symptoms started to worsen. And it was very taxing on our family, and it was very difficult because at one point in August, he had to stop working altogether because his symptoms just became too much to manage while trying to work full time. And then, so obviously that's a financial burden that happened that was really difficult to navigate. We planned for it enough because we knew since February that might ultimately be what happens until we're able to get a transplant and get some treatment for him. But ultimately he started to progress to be very sick, and we had to initiate dialysis that fall. And then that unleashed a whole other slew of complications and issues because when he started dialysis, he picked up an infection from a surgery that went wrong, which is a whole other long story in itself. And then from there, just complication after complication after complication that is not typical of a kidney patient necessarily, at least not every kidney patient, happened to him, where it was sort of everything that could possibly go wrong did.
We pay such high taxes here in Canada, and specifically in Ontario, into these social safety nets, into these programs that are supposed to help people in times of need, whether it be our medical system, where someone should be able to receive an organ transplant if they are in need and a good, healthy candidate, as this young father was, but also for families navigating financial hardships and burdens. And so how much of a difference did you see there in the government sanctioned social safety net versus just everyday people in your community coming together to help and support you through this?
Oh, it was our community, hands down, who was the main support for us, because we were stonewalled on all of the support from the hospital. The social worker was very difficult to work with and didn't offer any proactive support. I had to approach her for information about things like ODSP because she didn't initiate those processes on her own. So there was a lot of prejudice and bias against my husband, I think, because of his advocacy work. Because everybody at the hospital, I'm convinced, already knew who he was before he was admitted there for dialysis treatment. We had done a lot of really high-profile work in the community at the vaccine clinics. We even had done a protest at the hospital to sort of protest the fact that nurses were losing their jobs over mandates, and it was terrible. So he was at the forefront of all of those things. And I'm like I said, I'm convinced that everybody before he even stepped foot in the hospital already knew who he was. And because of that, I think our journey was made more difficult because people were really not willing to go out of their way to help us.
Mm-hmm. And what is life like now? I mean, it's been a few weeks since the tragic passing of Garnet. How is your family doing? How has this ultimately affected yourself and your children moving forward?
That's a difficult question. Anybody who's lost a spouse knows how difficult life becomes. Like immediately, there's no minuscule thing that you can point to in your life that's not different and that's not painful to go through with that person being gone. So
especially when it again is just a senseless, needless death that was easily preventable.
Yeah. So there's overwhelming grief. There's also a very real sense of anger. There's a lot of anger about what happened to him, how he was treated, and the injustices that really are happening in our country still. I'm having people write me every day. I receive more messages of people who are sharing their stories. There's people who are commenting on our fundraiser page. There's people who are messaging me personally saying, I'm in the same situation as your husband, or my mom is in the same situation because she's being denied an organ, and it's because she's not vaccinated, and all of this stuff. So it's a very real problem in our country, and it is scary because we are talking about an experimental injection. That's still what it is, because there is not sufficient research, and there won't be for at least 20 years about this particular vaccine and how it affects the body. And people are just not willing, like my husband was not willing, to be part of the experiment. And but I do want to add a point of clarification and say that although he was not willing to comply and be part of the experiment by getting vaccinated in order to get the organ that he needed, he was exploring every possible avenue for how to make that happen for himself in any alternative way possible. So whether that meant advocating for himself legally, whether that meant bringing his two brothers in, who both said they would like to voluntarily donate a live kidney to him, whether it was, trying to treat himself with alternative medicines by people who were actually supportive of what he was going through. He was trying every avenue that he could possibly find in order to stay here. So people keep on saying, like, he made the ultimate sacrifice, and all of this, but he never intended to be a martyr for this cause. He wanted to be here for his children. He wanted to be here for me, and he wanted to be here to see this fight through to the end. And he was going to find a way to make sure that he would get what he needed. And so on that, I'll also clarify too, like, he was winning his battle with kidney disease, in that he was progressing and he was healing himself enough to be eligible for to a better level of dialysis. We were going to start home dialysis within a couple of weeks. We were just waiting for our training to start, because the doctor deemed that he was healthy enough to start doing that. And we were going to win this, right? He died not from his kidneys ultimately giving up and failing. He died from a stroke, which is a complication of long-term dialysis.
Garnet was denied a referral to the London Health Sciences Centre multi-organ transplant program via email sent by Peggy Kittmer. Kittmer is a former registered nurse turned transplant coordinator for the LHSC, who made just shy of $109,000 in 2022. Now, according to a COVID-19 vaccination information resource for transplant recipients, the multi-organ transplant program in London requires that you have at least 2 doses of an approved COVID-19 vaccine before being listed for transplant, and encourages you to get 1 or 2 booster shots when offered to you. If you are on the waiting list and have not yet been vaccinated, you will be placed on hold until you can get 2 doses of the vaccine. Furthermore, it says that every recipient is unique and there may be cases where vaccination is not possible. Your transplant team will consider your situation and medical exemptions may be allowed. These exemptions are the same as those that the Ontario Ministry of Health has listed. Other exemptions include recipients who are too sick at this time to be vaccinated and need the transplant immediately. Children do not need to be vaccinated to be listed for a transplant. Then why did Kittmer say that there were no medical or surgical exemptions to receiving the vaccine? I reached out to Kittmer and the media contact at LHSC to ask just that. 1, what scientific rationale was used to determine that there are increased risks of morbidity and mortality in transplant recipients with COVID-19? Why did you assert that there are no medical or surgical exemptions to receiving the vaccine when the LHSC policy or recommendation guideline says otherwise? What exemptions are considered by the policy, and what is the criteria for approving and or denying them? Is the transplant coordinator responsible for determining exemption criteria and approving/denying them? If not, who is? Steve Robinson, Senior Media Relations Consultant, responded that Peggy had passed along my inquiry and he will respond as soon as possible. And now it looks like instead of responding as soon as possible, the London Health Sciences Centre was busy changing and updated the verbiage of their information resource guide, which I will feature in another report, so please stay tuned at organsnotcoercion.com, because those responsible for the denied referral of Garnet Harper have decided to willy-nilly update the guidance document used to justify their decision when they were faced with scrutiny, and we have the receipts to prove it. For Rebel News, I'm Tamara Ugolini. The lack of accountability while real people suffer the ill effects of coercive COVID policies is exactly why we have launched a petition campaign at organsnotcoercion.com, as this injustice infiltrates various provinces and territories all across Canada. Head on over to organsnotcoercion.com to view all of our reports, see how you can take action to get involved, and there you can also chip in to support our journalistic efforts if you can. All of that and more at organsnotcoercion.com. Thank you for your support.